Hello, everyone. We would like to take some time here and talk a bit about the role of occupational therapy in breast cancer care. We have a bit of an agenda here. We will introduce ourselves, explain what our field of occupational therapy is, what occupational therapy can offer for those having been diagnosed with breast cancer or currently going through treatment. And then we will offer some closing remarks. So my name is Tiffany Bystra. I am an occupational therapist, and my career has largely been involved in treating cancer patients in the hospital setting. I currently work with the University of St. Augustine for Health Sciences as a faculty member, and I do some work with the cancer support community as well, and some resource specialist procurement and role. I've studied some social work courses, particularly in psychosocial oncology concentrations, and I'm a member of the Cancer Alliance of Texas, as well as the American Occupational Therapy Association and the Association of Oncology Social Work. So I'll turn it over to my colleague here.
Hi, my name is Lesley Khan-Farooqi. I'm also an occupational therapist, and I'm an assistant professor at the University of St. Augustine. I have a certification for exterminating lymphedema therapy. And then I previously was a certified hand therapist from 2016 to 2021, and I'm now in inactive status. I'm a member of the American Society of Hand Therapists, and I graduated from Washington University in St. Louis, their occupational therapy program in 2010, and I completed my PhD in education in 2020.
Thank you. So we thought that we would introduce our discussion here about occupational therapy by asking the time and true question of what is occupational therapy? So if I had to give my most basic description of it, it is really taking a look at what the most meaningful and important things in your life are for you. And we break those down into what are called occupations. So they can be very simple daily tasks and self-cares, ranging from childcare to taking care of one's home, to returning to work. These are all broken down into what we consider occupations. So really the occupational therapist is going to take a vested interest in what is meaningful and important for you, and acknowledging that sometimes treatment, surgery can limit or inhibit one's ability to engage in those meaningful tasks. So we break occupations down even further into several different domains. So as you listen to us speak about occupations, you may think to yourself, this is something that either has not changed for me as a result of my diagnosis or my treatment or surgery, but some of them may have. So, we consider activities of daily living, or ADLs. So these are things like bathing, showering, functional mobility, otherwise known as just getting up and moving, getting from point A to point B in a safe manner, toileting, as well as self-cares. The next step up for occupations is going to be instrumental activities of daily living. So these are a bit more complex of tasks and can involve childcare, household management, making and preparing meals for yourself or others, driving and transportation, as well as managing your finances. Rest and sleep is kind of an under-discussed area of occupation, but we're here to have that conversation. Really the act of preparing for sleep and engaging in sleep, as well as finding comfortable resting positions, as well as restorative practices. We know that after surgery or after treatment, pain can be a pretty limiting factor for people. So we take rest and sleep and occupations that are restorative quite seriously, and that could be an involved part of our care too. Education, we know that formal education, so be it going to school or university, trade school, or even just enjoying learning and informally learning things. There can be some side effects of treatment, including chemo brain and some cognitive impacts. So if you find that returning to those education tasks are a bit more difficult, that's something that an occupational therapist might help you out with. And we see work. So returning to employment, if that's the case for you, volunteering, or just any means of productivity that you have exercised in your life. That is an area of occupation as well. Real briefly, some other areas of occupation involve play. So this is not just for kiddos, but for adults too. It could be physical play, social play, constructive and creative play. That's one of the most beautiful parts of being a person is recognizing the many occupations that make us us. And that's what we're interested in learning more about and helping promote participation in. Leisure. So you may have had, leisure interests that you actively sought before or during treatment. We can help with exploration of new leisure interests, finding, maintaining and optimizing engagement in those pursuits as well. Social participation, so familial and friendship maintenance skills, as well as maintaining and optimizing your engagement in your social participation. So we live within the context of our lives, and for many of us, a treatment and cancer experience can impact our relationships with people around us too. So occupational therapists are interested in that and helping you with some self-advocacy skills in your social participation, if that is a area of concern. Last but not least is health management. So we know that with any cancer experience, there can be a host of complicated organization strategies that comes with keeping on top of appointments and managing your medications. And that can be additionally complicated with some cognitive impacts because of treatment. So we can help with some of those cognitive supports of that medication management, organization for your appointments, as well as the self-advocacy skills in the clinic as well. So just to kind of wrap up our ideas around occupation, this may look like a typical morning, waking up, attending to your self-cares and getting dressed, making meals for yourself as well as others, attending to your household duties, as well as completing some work. So now that we know about occupation and how we break down tasks throughout the day, you can imagine that cognitive impacts of treatment, physical impacts of treatment, social impacts of treatment, the list goes on. It can be disruptive or inhibitory to any part of this routine. And this could be even just the first couple or few hours of your day. So we're here to help understand what that impact looks like for you and to help find new or different ways to problem solve through some of the challenges you may be experiencing.
The next area that we'll talk about is lymphedema in breast cancer. So lymphedema occurs when there's an abnormal amount of protein-rich fluid in an affected area. And usually it's associated when lymph nodes are surgically removed or due to radiation therapy. That increases the risk of lymphedema occurring. Doesn't always mean that lymphedema will occur if lymph nodes were surgically removed or if radiation occurred. If someone does need treatment for lymphedema, they're usually going to undergo complete decongestive therapy or CDT. And there can be multiple different people who have a specialization in lymphedema, but occupational therapists do have a specialization or can have a specialization in lymphedema. And if you receive complete decongestive therapy or CDT, it can consist of manual lymph drainage, which is a very gentle massage to help to bring the lymph back to lymph nodes to allow it to drain. Compressive bandaging and therapeutic exercise. That therapeutic exercise coupled with the compressive bandaging can help to pump that fluid out and and help to have it be more of an effective treatment, and also education on skin care and nail care as well. Another area that can be affected, as we talked about, both your physical health and your mental health and your cognitive health can be involved due to breast cancer treatment. There can be cancer-related cognitive impairment, and some people will refer to this as chemo brain, and it's a term used to describe problems with thinking or memory that can occur during or following cancer treatment. And symptoms may include trouble with memory, concentrating, organization, and problem solving. So there can be multiple different aspects affected, and they could be to different degrees. So it may just be a small issue with memory, or it could be more involved. And occupational therapists are there to help to kind of identify what the areas could be and then provide treatment. So occupational therapists can provide strategies to help to adapt and cope with thinking and memory problems. And they can do this in a number of different ways. So they may provide strategies that are adaptive, such as using a planner or reminders on your phone, or having reminders around your house, or they can use cognitive training exercises to essentially retrain the brain to improve cognition as well. So that's an area that OTs have expertise in, and is treating cognitive impairment following cancer. Another area that can be affected is neuropathy. So neuropathy is a term describing changes in sensation, or it could be a painful sensation due to damage in the peripheral nerves. And some chemotherapy medications have an associated risk of peripheral neuropathy. It's not very common, but it can occur sometimes. Occupational therapists can also provide strategies to help to adapt or cope with peripheral neuropathy. And these strategies may be adaptive, so it could be education on ways to reduce the chance of cutting or injuring your hands or your feet. That would be the area that doesn't have as good of sensation. So that could be things such as using gloves or handrails, because balance could be affected, or rubber-soled shoes, or being aware of environmental obstacles. We can also offer sensory education strategies. So this is kind of a way to, again, re-educate the brain to get used to that sensation and help to improve the sensation in the area potentially. So another common area that occupational therapists can address is fatigue management. Science supports that regular exercise can help to reduce fatigue. It can be hard to sometimes engage in exercise, but if you're able to, that can help to improve your energy level as time goes on. Occupational therapists can also provide education on energy conservation techniques to accomplish desired tasks. This could be education on potentially completing tasks in a seated position, or alternating heavy and light tasks, such as completing heavier or more involved tasks in the morning when you have more energy, or the times during the day that you feel like you have more energy. Occupational therapists can also provide strategies to help to support a healthy bedtime routine, because sometimes sleep can be an area that's really affected due to medication and stress and other factors going on. So they can provide education on some strategies to help to improve sleep quality and quantity as well.
Last but not least, we wanted to mention psychosocial needs. This is something that's increasingly being acknowledged and appreciated in cancer care, that not only can this be a difficult experience for the person individually, but their familial and their friend context as well. So occupational therapists, we help to understand your current areas of distress that you may be feeling, and explore means of managing and alleviating some of those stressors. Occupational therapists can help you to explore means of relaxation practice as well, to cope with those stressors that are brought about due to a diagnosis, treatment, etc. Occupational therapists may work with you on self-advocacy strategies when communicating with your healthcare team, friends, and or family members. Lastly, we know that roles that one occupies in their life, either as a mother or father, a worker, a student, these are all roles that can potentially be disrupted as a result of diagnosis or treatment. So occupational therapists can help with some of that role exploration, as well as finding new or different ways to engage in the roles that you find meaningful. In summary, our hope is that we help to describe a bit about what occupational therapy is and how it may be of benefit to you. So during and after your treatment, you may notice some changes in your comfort and ability to complete your daily tasks that we consider occupations. If you experience some decline in your functioning and you wish to address this with a professional, occupational therapy may be of benefit to you in your recovery. So if that is the case, it may be indicated that you ask your healthcare team if occupational therapy is right for you. So in summary, here is our contact information, and we thank you for tuning in with us and learning more about OT and breast cancer care.